Hello, everyone. Myself, Dr. Vinod Kaushik. On the behalf of IAP India technical team, just welcome to you all. I just showed my gratitude towards Dr. Sanjeev K. Jha, IAP President, and Dr. Ruchi Vasne, IAP Women's of National Head, for providing us this wonderful platform for sharing the knowledge. Today, we are having the webinar organized by IAP Bihar branch. The topic of the webinar is You Are the Greatest Project You Will Ever Work On by Dr. Smita Singh and Dr. Anuja Bharti. Now I will just hand over to our moderator. Please see and continue the webinar. Thank you.
Thank you, sir. Hello, everyone, and a very good evening. First of all, happy Women's Day to all our lovely ladies out here. Welcome to this Women's Day special webinar. I am Chandini. I will be the IT facilitator for today's webinar and will be there to assist you on the session. Before we kick off, let's all stand for our national anthem. Thank you. IAPWC Bihar has organized this webinar on Women's Day, which gives us a platform to connect with entire medical professionals under single umbrella. For a hassle-free webinar, please follow the instructions which I am reading out. Sit in a quiet location where you will not be disturbed. Use appropriate equipments. Please be on mute while joining the meeting, especially the panelists. Please post all your doubts, queries on your right-hand side of screen in a chat window. We'll get back to all your questions towards the end of the session. On this note, I would like to invite Dr. Reena ma'am. Over to you, ma'am.
Thank you, Chandni madam. Very good evening, respected seniors, all the participants who are here with us. I, Reena Srivastava, Zonal Head of East Zone, welcome you all on the behalf of organizing committee of this event. First of all, happy International Women's Day to all of you. This year, the theme of this day is Women in Leadership, Achieving an Equal Future in a COVID-19 world. This day is an opportunity to all the women from all over the world to raise awareness about the crucial contribution to the profession makes to keeping people well, mobile, and independent. So, on this occasion, we organize an awareness webinar by IAP WC Bihar branch under the guidance and excellent leadership of our National President of IAP, Professor Dr. Sanjeev Jha sir, and our National Head, Dr. Ruchi Vasne ma'am. Try to make sense of what you see and wonder about what makes the universe exist. Be curious and how weird difficult life may seem. There is always something you can do and succeed at. It matters that you don't just give up. Dr. Ruchi Vasne, IAP Women's Cell National Head, Treasurer IAP, believes Faith is daring to go beyond what the eyes can see. Don't lose hope when the sun goes down. Please welcome ma'am and give us shower of blessing. Ma'am, please.
Thank you. Thank you, Reena ma'am, for your wonderful and kind introduction. You're looking very gorgeous today. And thank you to the IAP Women's Cell Bihar branch, Smita ma'am, Josni ma'am, and the entire team, to our wonderful host and facilitator, Chandni. And last but not the least, Anuja ma'am. Anuja ma'am is associated with Women's Cell, I think, for more than a year now in various capacities. She is always supporting and guiding the Women's Cell team, especially Bihar. So this is her love for the profession, which brings her back to the platform again and again. Thank you so much, ma'am. I wish everyone, every participant, happy International Women's Day, 8th March. And as Reena ma'am has told that the theme is appropriate, I think that is the theme which we started shouting 3 years back. That is women in leadership. That is the real challenge, to have women in leadership. Why it is so that not many women come at the top position? What is the reason? So this is how the women's cell was created and conceptualized by our president and CEC in 2018. And women in leadership creates, it is not very easy to be in the position. It is not very easy to sustain the position. It is not very easy to perform at the position. और इसीलिए होता है कि बहुत लोग वहां पहुंच नहीं पाते, क्योंकि वहां पहुंचने से पहले वो गिव अप कर देते हैं. So here on this Women's Day, when the entire globe is celebrating the women who are in the leadership position, I want to tell everyone that कुछ साल पहले ये लगता ही नहीं था कि more than 20% women will be in the policy making in the National Association of the Indian Association of Physiotherapists. And now we have 5 strong women in the Central Committee. We have very strong our Women's Cell Committee zonal heads. We have very strong state teams, and we have a lot of, more than 10,000 women working in tandem with each other, supporting and cooperating with, each other. So ab wo situation nahi raha that when a woman feels that there is no one who can listen to you, when a physiotherapist female shifts from one state to other state, getting married, getting some problems, anything, and then she has the team there in the state to stand with her. People are actually, they are looking at the women's cell now, because this is the only committee in the in any medical association doing wonderful. Because otherwise नाम के लिए females को leader बनाना, नाम के लिए committees बनाना, और नाम के लिए women को respect देना, I think it is enough of it. It is now hard time when we all start performing, when we all start showing कि Women Day एक दिन का नहीं है. Women's Day is for the entire year. Each day you should celebrate this Women's Day. And for all the males as well, एक ही दिन respect देने की जरूरत नहीं है. I think हर दिन एक women deserve करती है वो respect, वो प्यार, वो विश्वास आप सभी का. Because men are also a very important part of this, this profession. हर एक तरीके से एक cycle है और उसके 2 पहिए हैं, एक male और एक female. This is a female dominated profession. So kahin na kahin women ka role in policy making has become very important, as has been shown in the past also. So now I would like to thank last Smita ma'am. Smita ma'am, you are a very strong example of an empowered woman and a women in leadership. You've been doing a great work. And your zonal head, Dr. Reena Srivastava ma'am, who is always there to, meaning the states each zone is doing fantastic. Seniors like Josni ma'am, seniors like Anuja ma'am, they are there always with the team. I thank you wholeheartedly. और I wish कि ये Women's Day एक नए आयाम के साथ एक नया कुछ लाए हमारे Indian women के लिए, physios के लिए, और हम बहुत जल्दी अपनी काउंसिल पाएं, हम बहुत जल्दी अपना जो हम डिजर्व करते हैं वो रिकॉग्निशन वो हमें मिले, हमारे प्रोफेशन को मिले और हमारी एसोसिएशन को मिले. थैंक यू सो मच.
Well said, ma'am. Thank you so much for your inspirational words.
Thank you.
Thank you, ma'am. A woman with a voice is by definition a strong woman. We need to reshape our own perception of how we view ourselves. We have to step up as women and take the lead, as Dr. Ruchi ma'am is saying. So the topic of today's webinar is You Are the Greatest Project You Will Ever Work On. So not wasting much more of your time, now I would like to introduce our resource person and panelists of this event. Today we have with us Dr. Anuja Bharti ma'am. She is MBBS from NMCH Patna and DNB in Pediatrics from Fortis Escort Hospital, Faridabad. She has post-PG 7-year experience and also served in reputed hospitals like Global Hospital Chennai, Apollo Hospital Chennai. She is also the clinical teacher in Sebang, China, former registrar in Global Hospital Chennai, self-practitioner in Medinspine Clinic Chennai. She will today give a talk on breast cancer. And our next speaker is, she need no introduction, Dr. Smita ma'am. She is MPT in sports, certified manual therapist, diploma in trauma and emergency management, PG diploma in autism, also diploma in yoga, pioneer in pranic healing, traditional Ryusai Tai Chi. And she is also the chairman of Swastik Kalyan Kendra, Swastik Health Center. She is also our state coordinator of IAP Women's Cell Bihar. She has been one of the main proponents of this program from several days. Besides that, she presented more than 50 national and international papers and has given many awareness talks on national channels and trained more than 2,000 people in CPR. She has organized several training programs from kangaroos mother's care and breastfeeding in rural areas. She will give a talk on fitting underwear and V. And we are very lucky that today we have with us Dr. Josni Khan ma'am. She is co-opted EC member of IAP Bihar branch and joint coordinator of IAP Women's Cell Bihar branch. She is the senior consultant and HOD, Advanced Physiotherapy and Rehabilitation Center, Patna. And she is also the associate professor of IIHER. Welcome, ma'am. And I also welcome the sub-coordinator, Dr. Runjun Agrawal, Dr. Abhilasa Sinha, and Dr. Smita Singh. And our EC member of IAP Bihar, Dr. Purnima and Dr. Arpana Anand. So today I welcome Dr. Anuja Bharti ma'am to start the session. Ma'am, please welcome.
Hello,
Ma'am,
everyone.
One second, I would just like to say one more thing that I would like to thank the IAP digital team who's conducting all these webinars back to back the whole day, 7th, 8th, 9th, they are booked. Thank you, Dr. Vinod Kaushik sir and Uttara, everyone who's associated and giving us this platform. Thank you. Please,
Thank you,
Anuja ma'am.
Yeah. Hello, everyone. Thanks a lot, especially Dr. Ruchi ma'am and Dr. Reena ma'am for giving a wonderful introduction. And hello, everyone. Welcome to the platform. I especially thank to invite me as a speaker on this very important topic on breast cancer. And I hope and wish that my little bit of knowledge could bring a big change in your perception and thought about your breast and its health. Well, so it is a breast cancer awareness. So before this, we should know what is breast cancer. When we use the term cancer, it means the cell is growing out of control. So when the cells of the breast begins to grow out of control, it leads to breast cancer. It can happen either from the duct, which is more common, or from the gland. However, there are other types of breast cancer as well. But do we really need to worry? Yes, we should, because it is the most common cancer in women in both developed and developing nations. The incidence increases with age, all women are at risk. And let me tell you, according to the recent study by International Agency for Research on Cancer, done recently in December 2020, breast cancer has now overtaken lung cancer as the world's most commonly diagnosed cancer. So before we go ahead and understand what are the different types of breast cancer, we should understand how our breast actually is. So when you see in the picture, you can see the center part of the breast is the nipple. The segmented around the nipple, the brown pigmented area is the areola. Behind the areola are the ducts. Ducts is a kind of a channel, a tube, and behind the tube is the gland, which stores milk. So depending on this, there are different types of breast cancer. Mainly there is a ductal carcinoma, which can be subdivided into ductal carcinoma in situ and invasive or infiltrating ductal carcinoma. The second type is a lobular carcinoma, and there are other types like phylloid tumor, angiosarcoma, inflammatory breast cancer, and many more. Now, if you see the incidence of different types of breast cancer, as seen in the picture, you can see the yellow, 54% is invasive ductal carcinoma. So this is the most common type of breast cancer we can face. In decreasing order, when we see, we go to ductal carcinoma in situ, 23%, followed by invasive lobular carcinoma in situ, tubular carcinoma, mucinous, and so on. So if you see the picture, the different types of breast cancer you can see here is, as I told before, ductal breast cancer. So ductal is the one where these cancer cells are limited to the ducts, which is shown in the red color. On your right hand side, you can see lobular breast cancer, where the cancer cells are involving only the breast lobes. Again, on the left down, there is a mixed tumor breast cancer. Mixed means it involves both the ducts as well as the lobes. On the right down, you can see mucinous breast cancer, which involves the interstitial area. And last but not the least is inflammatory breast cancer. It is called inflammatory because it is a breast cancer, but it takes the mask of getting inflammation. So one important thing is what causes breast cancer. Breast cancer is always caused by a genetic abnormality, mistake in the genetic material. However, only 5 to 10% of cancers are due to an abnormality inherited from your mother or a father. Let me tell you, 90% of breast cancers are due to genetic abnormalities that happen as a result of aging process, wear and tear of life in general. So, if you see this, there is a big misconception. Many of us think, oh, in my family, my mom, my sister, my aunt, they are having a breast cancer. I am very, very likely to get breast cancer. No, not at all. The likelihood of this is only 5 to 10% for you. The remaining 90% is because of your aging process. So the home taken task is you have to be fit and fine as you grow older. So when you see the risk factors for breast cancer, female, as usual we know, is more prone to breast cancer. But it doesn't mean that males cannot have breast cancer. So males should be well alert that they can also have a breast cancer with an incidence of 1%. 1% means 1 in 1,000 males can develop breast cancer. This is because breast tissue is not a belonging of only for the females. It is present both in males as well as in females. Race, it is more common in whites, increases as a woman gets older. Relative like mother or sister, if are positive for breast cancer, yes, your chances or likelihood increases. Menstrual history, if you have an early onset menarche or a late menopause, those are risk factors. And childbirth. If you do not bear a child or you bear a child after the age of 30, it increases your chances of getting breast cancer. At the same time, pregnancy and breastfeeding are always and always protective against breast cancer. Apart from this, there are various environmental factors for breast cancer like obesity, fat and alcohol, lack of physical activity and stress, radiation exposure, history of cancer in other female genital parts like uterus, cervix, and ovary, hormonal therapy as in case of hormonal replacement therapy and use of birth control pills, and genetics, as I told before, few which are inherited. But let me tell you again, more than 70% have no risk factors. However, there are few controversial risk factors like antiperspirants, bras, and induced abortions. There is no proven evidence to show that these are related to breast cancer. Now we come to the signs and symptoms of breast cancer. New lump or mass in your breast is the most common symptom of breast cancer you can have. When you see this picture, visible lump in your breast, nipple change, whether it is eversion or it is inversion or retraction. There is a change in the color or texture overlying the skin of your breast. There is a dimpled or depressed skin, or there is a bloody discharge from your nipple. Any of these signs can give a hint to your breast cancer. So these are a gross pictures of various images where you can have a click that it can be a breast cancer. There are various preventable risk factors which we can control. It is in our hand and we can prevent us from breast cancer like obesity, not having children. You have to bear children at a younger age, breastfeeding very protective, avoidance of alcohol, hormone replacement therapy, and doing proper fit exercises to prevent breast cancer. We have to get to and stay at a healthy weight. You have to be physically active, moderate to vigorous physical activity. In fact, the American Cancer Society recommends that an adult get at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity each week, preferably spread throughout the week. So when you are in a crowd, some women in this crowd may have early cancer. So how to detect it? Well, there are various screening tools for detection of breast cancer. Screening test means what? It means a test or examination used to find a disease in people who don't have any symptoms. So this is a very catchy point. You don't have any symptoms, still you can find out a cancer inside your body. This definitely is very important test before you enter into the door of cancer. Breast cancer found during screening examinations are more likely to be smaller and still confined to the breast. Hence, the good part is you can treat it very well and completely. So there are various tools as a screening for breast cancer like breast self-examination, self-awareness, clinical breast examination, and a mammogram. When you do a screening, how frequently you do a screening for breast cancer is a method by which you can be expertise in finding out the size of the lump. When you see the first picture, this is the size of the lump you can detect by a woman who practice occasional breast self-examination. If you do it occasional, you can detect this size of the lump. Downside, if you do a regular breast examination from occasional to regular, the size of your detection for the lump, you can see it decreases. You are become more expert in finding out the lump which is smaller than the first picture. The third picture is the size of the lump found by a first mammogram. And the last picture, which is like the seed of a mustard, it is the average size lump which is found by getting a regular mammogram. So breast self-examination is a very simple, home convenient, effective opportunity and a screening tool for detecting your breast cancer before you wait for the symptoms to happen. It is an opportunity for a woman to become familiar with her breast, Monthly examination is needed for the breast as well as the underarm area. Underarm area axilla we say because we can check a lymph nodes in the axilla where the breast usually drains. Many discover any changes early if they do a breast self-examination. Ideally, you should begin this at the age of 20 and continue every month. So this is a simple step how you have to do a monthly breast examination. The best time for a breast self-examination is about a week after your period ends. So if you are menstruating, you have to do your breast examination after a week. This is because that time your breast will be non-tender, no swollen, and you can do your examination more better and conveniently. In menopausal women, you can do your breast examination anytime, but that time should be fixed day every month. So when you see the steps, there are 3 steps of monthly breast examination. Step 1 is a lying down. Step 2 is in front of the mirror. And step 3 is in the shower, which can be optional. In the lying down step 1 posture, you have to lie on your back. You have to place a pillow under left shoulder and put left hand behind head so that your breast is flat and you can appreciate the lump more cleanly. You have to use the pad of your fingers, middle 3 fingers, which has to be flat so that you can completely palpate your breast very easily and more with expertise. Use your left hand for the right breast and your right hand for the left breast. You have to use 3 pressures, 3 levels of pressures, light, medium, and firm in a circular motion without lifting your fingers off your skin. It has to be stick to the skin and you have to go in a circular motion. Follow an up-down pattern and repeat same steps on the right side. So this is step 1. Step 2 is in front of the mirror. You have to stand in front of the mirror and look for any changes in your breast from the normal. With arms at your sides, first you inspect both the breast. Then you raise your arms above your head. Third, put your hands on your hip, flex chest muscles, and compare again. Finally, 4th step is you have to bend forward with hands on the hips. You have to examine the entire area under the collarbone. You should not examine only the breast area. You have to go up and down. So you have to examine the entire area below your clavicle and down across your rib cage up to the breastbone. What you need to see? You need to see any lumps, any knots, swelling, dimpling, or thickening. And you have to see any changes in the size, shape, or color, or any discharge from the nipple. The 3rd step is in the shower, which is again optional, and it is same as a step 1, like in lying down. The only difference is when under the shower, you have a wet breast and you can more easily palpate and inspect your breast for any lump. Let me play a video for you to just see grossly how to do a breast self-examination because it is very, very important. So this video was just to have a perception in your brain how a breast self-examination should be done, and you continue it after this webinar gets over. This is because we don't practice breast self-examination. The reasons are many, but the most important reason and the most common reason is we don't know how to do it. You can see a study was conducted in which 29.7% of the females don't know how to do breast examination. So from now onwards, we should stress ourselves on doing a breast self-examination because it is our responsibility. Apart from that, there are certain other reasons like, I don't have any breast problem, why should I do breast self-examination? You don't have any problem, but the problem can happen in future, so beware. Apart from that, there is carelessness, forgetfulness, our busy life schedules, and many other reasons. The second is a clinical breast examination. The name says itself, clinical. So it has to be done by a proper clinician or a trained nurse. Women in their 20s and 30s can have a clinical breast examination as a part of their regular health screening, at least every 3 years. But after the age of 40, women should have a clinical breast examination every year. So you can see in the picture, it is performed by a doctor or a trained nurse practitioner. And as told before, after the age of 40, it has to be done yearly. Before 40, it has to be done every 3 years. And in females who are high-risk patients, it has to be done more frequently, can be every 6 months as well. When I say high-risk patients, it means either you have a family history of breast cancer, or your mom, your sister, your aunt has been suffering from breast cancer. You have few gene positive breast cancer, which we call as HER1 and HER2, and many more. Let's come to the diagnosis for breast cancer. As I said before, mammogram is an early detection screening for breast cancer, but it is also a diagnostic approach, depending on whether a woman is a high-risk woman or an average risk woman. In average risk women, the mammogram is done depending upon the age. If you are between 40 to 44 years, or roughly we can say if you are less than 45 years, you have the optional mammogram. That means it is your choice whether you want to go for a screening every year or not. If you have crossed 45 years of age, you should get a mammogram every year. That means you have to do it annually. If you have crossed 55 years of age or attained 55 years of age, you can switch to a mammogram every 2 years, unless you yourself choose to continue with yearly mammogram. In high-risk women, you should get a breast MRI and a mammogram every year, typically starting at the age of 30. Because these females are high risk, they have to prepone their they have to prepone their age of screening and diagnosis, and MRI has to be added on a mammogram to be more picky for the breast cancer. If MRI is used, it should never be in addition to, it should be never be singly diagnostic tool. It should always be in addition to a mammogram for detection of breast cancer. So this is a mammogram picture, as you can see, where the breast is in between the two shields, and it is a low dose X-ray where your entire breast tissue can be visible. Now, a common question among the public, is mammogram safe? When we say the word mammogram, most of the females, no, I cannot have the mammogram. It is not safe. Let me tell you, mammogram is a very low dose X-ray which exposes the breast to a very small amount of radiation. And the benefits of mammography outweighs any possible harm from the radiation exposure. To be very clear, the exposure which you get from a mammogram is just 0.4 millisievert versus 3 millisievert, which you are exposed to a radiation in a whole week of your normal lifestyle. The second diagnostic tool is a breast ultrasound. It is useful for some breast changes, especially lumps, those which can be felt but not seen on a mammogram, or in women who have a dense breast tissue. The ultrasound is also useful to differentiate between a fluid-filled cyst and solid mass, and it is used to help guide a biopsy needle. The third diagnostic approach is a breast MRI. It is useful to determine the extent of your breast cancer and to screen for breast cancer. As I told before, it is never done alone. If at all it is done during screening, it has to be added upon with a mammogram. So this is a breast MRI where you have to lie prone with your breast hanging in a small pocket. And then you have to enter inside the machine and they will check the picture. The fourth diagnostic approach is a biopsy. Needing a breast biopsy does not necessarily mean you have cancer. The moment any patient comes to the clinic and you say that you need a biopsy, 99% of them start believing that they have a cancer. No, not at all. Biopsy doesn't mean you have a cancer. It just means that we want to make sure you don't have a cancer. So it is the only way to find out for sure. So there are different kind of FNA biopsies. There are different kind of biopsies such as fine needle aspiration biopsy, core needle biopsy, surgical biopsy, and lymph node biopsy. Now coming to the treatment protocols, the best breast cancer standard treatment is divided into local and systemic. In local, we have a surgery and a radiation therapy. In systemic, we have a hormonal therapy, chemotherapy, and targeted therapy. When we see this surgery, there are different kinds of surgeries for breast cancer. To just let you know grossly, there is a lumpectomy where the lump of the breast is getting removed. There is a lymph node dissection, which is done in slightly advanced stages of breast cancer where your lymph node is involved. So we have to dissect and remove out those lymph nodes, which can be either axillary, also called as sentinel lymph node. And last is a mastectomy, where the whole breast is removed. Second treatment protocol is a radiation therapy done by a radiation oncologist. There are different kinds like external beam radiotherapy, brachytherapy, intraoperative radiation. Third is a systemic therapy, which is done by a medical oncologist. They attack cancer cells throughout the body. That's why it is called systematic. It involves chemotherapy, hormonal therapy, and targeted drug therapy. So these radiation therapy, chemotherapy, and hormonal therapy is as an adjunct to surgery, depending upon the stages of cancer. Sometimes the radiotherapy and especially the chemotherapy is done before surgery when it is called as neoadjuvant chemotherapy, but mostly it is done after surgery when it is called adjuvant chemotherapy. Once your breast surgery is done, some persons can opt for a breast reconstruction. The purpose is to rebuild the shape and look of your breast, and it may be used to prevent scarring and deformation of the breast. There are few pictures of the breast reconstruction. You can see in the first picture, the whole breast has been removed, called mastectomy. And this lady wanted a cosmetic reconstruction of her breast. So there was a post expander and an implant, and how beautifully the lady has attained her original breast as before. There is another picture of pre and post tissue and implant combined. Well, being a pediatrician, I wanted to present this slide as well, which is very common. Can I breastfeed during cancer treatment? Sorry to say, but you should not breastfeed during cancer treatment. This is because if you are suffering from breast cancer and continue breastfeeding, or rather start breastfeeding, you are increasing blood supply to your breast, and at the same time, you are feeding your tumor cells inside the breast more and more to spread much. So most doctors recommend that women should not start or rather stop breastfeeding if at all they are doing. And secondly, breastfeeding is not recommended if you are getting a chemotherapy, hormonal therapy, or targeted drug therapy, because In any of these therapies, the drugs enter through the mother's milk into the baby and can harm the baby as well. So you should not breastfeed during cancer treatment. When we come to the staging of breast cancer, there is a T and M staging for breast cancer. T for size of the tumor, N for node status, lymph node status, and M for metastasis. Staging is important because it guides us to the mode of treatment we need for a particular breast cancer stage. When we see the prognosis for breast cancer, there is a 5-year breast cancer survival rate depending upon the stage. So there are total 5 stages of breast cancer starting from stage 0. And you can see at stage 0, the survival rate is close to 100%. So what is catchy in this? The catchy is we have to be very, very alert to detect our breast cancer in stage 0. So here comes breast self-examination. If you catch your breast cancer stage at 0, you are close to 100% survival rate, which is completely a clean sixer. When you approach to stage 1, stage 2, 3, and 4, gradually the survival rate decreases from 98% to very sad 22% in stage 4. There are various breast myths and facts. I should dispel those myths before ending the topic. So first myth, I have no family history of breast cancer. I don't need to worry. Sorry, you can develop breast cancer from environmental and lifestyle risk factors, which is more profound than family risk factors. Myth number 2, finding a lump in the breast equals cancer. No, 80% of breast lumps are benign and non-cancerous. It can be a cyst or it can be some mass which can be easily removed without having any cancer effect. Myth number 3, only women get breast cancer. Let me tell you, males as well, you can also have breast cancer and your likelihood is 1 in 1,000 crowd. So you should be also careful against breast cancer. Myth number 4, breast cancer only affects women over 45. According to a US study, it is found that 14,500 women under the age of 45 are diagnosed with breast cancer. I don't think it is a very small number, so be careful. Myth number 5, a mammogram can cause cancer. No, mammogram is a low dose X-ray which helps you from getting protected against breast cancer. And last, regular mammograms prevent cancer. No, regular mammograms just help you to detect your breast cancer if at all it is present. Prevention is only by you by taking proper care and attaining a treatment at a correct stage as early as possible. So we should all together fight against breast cancer. We don't know how strong we are until strength is the only option we have. So fight against breast cancer and fight as early as possible. Happy Women's Day, all of you. Thank you.
Thank you, Dr. Anuja ma'am, for such an awesome and informative presentation. Thanks again. So let me remind you, we'll get back to all your questions towards end of the session. So just park all your questions in our chat window and also in IAP YouTube channel chat box. Now I would like to invite Dr. Smita ma'am to throw some light on a hidden topic. Over to you, ma'am.
Thank you so much, Chandni. Well, believe in yourself and the world will be at your feet. Thank you so much, Reena ma'am and Ruchi ma'am for such a wonderful introduction. So today we all are here to celebrate International Women's Day. And as a women, we should know how to carry ourselves and to be strong at each and every stage of life. So today, we are going to talk about few risks which we are unaware of. So let's be aware and know your risk. Now, before we start, we all are, as a woman, using undergarments, and we are not aware which kind of fittings we should have. So, wearing an ill fitting bra isn't just uncomfortable, it's bad for your health. There were several researches being done and still it's being done, and researchers have shown that a lack of breast support often leads to breast pain, which is reported to by 50% of women. Well, we'll divide this into two parts: ill-fitting bras with general complications which are causing, and in the second session we'll have how to select a correct fitting. So now, before we start, we should know what is the history, because without knowing the history, we'll not be able to know what exactly we are wearing and what exactly are the problems which are being faced by most of the women, which are hidden. So the concept of breast bags or shirt with bags, it came long, long back in 1300 and 1400 BC respectively. I mean, it was too long, but basically it was to hold the larger breast. And in later stages, it came for, people, especially females, they took it for beautification. So they emphasized on corset, and the concept of corset was given in France by Queen Catherine in 1533. And later, exactly, the corset was, taken shape in 1596, which was known as a pair of body. It was divided into two parts actually, and slowly it started taking shape and regular fitting styles. And later in 1905, first the concept of bra came, and this was basically focusing on health and function, so from beautification to health and function. So later on, in World War One, this concept came to Asia, Africa, and Latin America. And beforehand, it was mainly centralized or focused in European countries. So year wise, the different forms of bra started coming into play, and the different names were given, like cups, then cleavages, then bullet bras came into the form. Then in 1977, the most important sports bra came into existence, and likewise the concept of bra kept on changing. So, what are the main causes? What are the main problems which are coming up due to ill fitting bras? So, an ill fitting bra that doesn't give the right support can also lead to breast skin damage. And usually, it's stretch marks are being seen, there are skin tightness, then many a times there are abrasions. So, here you can see two pictures where two tight bra straps are being marked as red circles. Now, downward, you can see that the breast tissues are coming out because of the tight straps. Again, here you can see the weight is being carried up by the strap. So because of that, strap supporting most of the weight here. So this is again creating a problem. Now, the underwire problem, because of that, again, the pressure increases and abrasion of tissues and other problems comes up, which we'll see later on. So most women are wearing the wrong size bra. We don't even know what kind of fittings we are having, right? So, what are the complications? What are the problems which might come up? So, we might get chest and shoulder discomfort. we get breast pains. Mestralgias, no, basically there are different types of mestralgias, but here we'll be talking at rest and exercise induced. Here in this picture, you can see that where do we get the pain because of ill-fitting or tight-fitting dresses, and where we do get the musculoskeletal pain, and where do we get the exact breast pain. So the red color is showing musculoskeletal pain, and the pink color here, it's showing the true breast pain. So this is the mark. I mean, how do we demark between the pain is being shown in the picture. Because of ill fitting, we get poor posture, and neck pain and headaches. We get back pains. Rubbing and cuffing leads to abrasions. Excessive breast movements, which importantly can lead to reduced participation in activities, especially exercises and sports, which we know is essential for good health. And we keep on doing the exercises with tight fitting bras. So basically, bras are pain. Yes, really, when it is not fitting properly, they are pain, and we are not aware of. So we do get breathing problems and complications. So we are not aware we are getting because of unfit bras. Unnecessary pressures on the shoulders we have headaches, we have reduced arm function, and limited range of motion comes. There are many more. So we see that generally ill-fitting bras causes permanent changes to your body tissue. In the picture down, you can see here, in this picture, you can see that. So permanent changes to the body, such as deep grooving in the shoulders caused by pressure, because the straps are exerting pressure over here, which is going to form a groove and is painful. Then you have ill-fitting bras having even been associated with the desired breast reduction surgeries mainly. And it has been seen in 80% of the women wearing poorly fitting bra, and those women have gone for breast reduction surgeries. Now, we'll take a few of the complications. It's not possible to take all the complications, so we have taken very few of them. So, what is bra strap syndrome? This is very important one, and most of the women are getting and they are unaware of. So basically, costoclavicular syndrome is also called as bra strap syndrome. And what happens here, because of ill-fitting bras, what happens that there is a pressure being exerted on the shoulders, and that is causing neck pain, shoulder pain, and upper back and arm pain. So main thing what we have to see is, when can it happen, right? So very tight bras with tight small and tight thin straps. What has happened? Can you see the screen?
Yes, ma'am, we can see it.
The presentation is being viewed.
Yes, ma'am, we can see your slides.
Yeah, sorry. So like usually very tight chest bands, wrong cup size. Now heavy breast, and especially in the middle-aged women, tends to have the impact, and this causes problem. Now, why is it stuck? ये क्या हो गया? What has happened?
Yeah, ma'am, we can see your slides.
Why isn't it visible to me properly? Chandni, could you please check out what has happened? Because I'm not able to move it.
Okay. Do you want me to share your slides at my end? Should I take?
Yeah, you can do that.
Okay, ma'am. Let me know once you see my screen and tell me your slide number as well. I'll be sharing my screen.
Now is it visible?
Ma'am, we can see it.
Yeah, so it's changing now. So,
okay.
Yeah, sorry. So now here you can see that in the picture, you have a first figure. Here, the shoulder contour is normal. The line is straight, right? You can see here. Now coming down to the second one, here the dropped shoulders can be seen. That is because of tight bands, which is exerting a pressure. So generally just focus in front, you have clavicle, and just behind the clavicle you have first rib, right? And at the back you have scapula. So this is forming a groove. So from this groove there are, or I mean in other term you can say that it is an outlet from where the vessels and nerves are passing by. So what happens when there is a tight band here? This is compressing the nerves and arteries which are passing inside the groove. So what exactly happens? So when you wear a bra that have very narrow straps, so this leads to a real tight pressure over here. So they may compress the veins and arteries around the neck, around this area. So thin subclavius can be causing a similar mechanism here apart from your bra strap syndrome. Now, what is the basic mechanism? We have to understand that. So because of the tight, narrow brachial straps supporting heavy breast cut into the soft tissues and shoulder, what happens? A pressure is being exerted here downward on the clavicle, usually around the junctions, the middle two-third and lateral one-third. The pressure is being exerted at this point, and because of that, there is a seizing action on the clavicle against the first rib, because the first rib is just beneath that, so it's exerting a pressure onto it. And because of that, there is a narrowing of the passage, right? So this exerts a pressure. Because of that, there is a stress on the costo-clavicular bundles, which happens to stretch away the nerves and the vessels. Now, what happens when breasts are too heavy? So in the picture, you can see here marked yellow, red, and cross. So what happens exactly? So these are the points where exact pressures are being exerted. So breast related shoulder neck pain is thought to result from changes in center of gravity, and larger or heavy breast may lead to continuous tension on the middle and the lower fibers of the trapezius muscle. Here we can see this is the zone, right? So the middle and the lower trapezius. So all the muscles apart from this, your rhomboids are also getting affected. We'll be seeing later. So Ryan et al., what he said, that elevation of the breast in a brachial, this increases downward force on the outer scapula. And what he suggested was the posterior straps of a brachial acts as a pulley over the shoulders, doubling the total downward pull on both the shoulders. So what effect it can have? Permanent indentation, red marks. Here in the picture, you can see the red marks and the groove being seen. Headaches can be caused, and muscles of the neck like trapezius gets easily fatigued. So this pain increases with carrying bags or handbags on the shoulders, and when you take rest, it gets released. So rounded shoulder and forward neck posture is being seen. So what to do? Very first thing is Remove your bra while sleeping and also when you don't need to wear. So keep at least one finger gap between your strap and the shoulder. Here you can see 1 to 2 finger gap should be there while you are wearing the bra. So get a shoulder pad for the straps. Wear cross strap bras here. Cross strap bras should be used. Then you have a cup size. So the cup size should be a fit. So underwire bras should not be worn for longer hours. We'll see in the later slides what are the under bras and why we should not wear for longer duration. The side support can be opted for which is available in the posture bras. Now, which all muscles to train? It's most important as a general or a physio. So there are few muscles which need to be stretched, few muscles need to be strengthened. So you need to correct your posture too. So start stretching pectoralis, upper trapezius and levator scapulae. Start strengthening rhomboids, middle and lower trapezius, serratus anterior and neck flexors. Watch your posture and keep doing chin tuck-ins because chin tuck-ins helps you a lot. So keep on doing in between your workplace, whether you are resting or you are in kitchen or you are in office. So chin tuck-ins are most important. Now, here, what exactly is posture? So posture is more than just the way you sit or stand. So there are several changes in your adaptation due to ill-fitting bras. Now, here you can see in the center, there is a picture which is showing the right alignment of your spinal curvature. Because of ill-fitting bras, what are the changes in your body is being marked here. So what happens? You try to protrude forward. When a pressure is being exerted here, hump starts forming in this position. So when a hump will form, automatically your posture is getting to distort. So the pressure will be exerted near this area. Now, again, other complications like, as you say, cross syndromes, and then frontal headaches, your temporomandibular area. Now, your lower fibers of the trapezius and the middle fibers of the trapezius getting affected. In front, your pectoralis major and minor, scaleni. So these are the parts. Here, you can see the correct alignment, which is being shown with green dots, and this is the position being adopted because of ill-fitting bras. So coming next, in this picture, see this female. Now, this should be the exact position which is not being maintained. Now, several studies have been made and that has shown that more than 52% of all women wear the wrong bra size. We are not aware which type is fitting and what are we supposed to put on. Now, very easy way you can see here in this picture, sorry, we are showing that first one is showing you the normal and exact position or your posture which should be maintained. Now in the second, you can see the small zigzag, that is mild protrusion of the chin forward head, right? Now in the third one, you can see larger zigzag. And in final fourth one, you can see over corrected. So here the head is going into extension. Now, know what? The Alexander technique works wonder. I'll, I am, and I use this when really I was in pain and when I met an accident and I really experienced that it helped me a lot to correct my posture. So like you have different techniques, but I feel Alexander technique works wonder in posture correction. It's my view. So actually what Alexander technique is, Alexander, he was a actor who was very intelligent too, and he developed laryngitis. and he was having choking of voice whenever he was on the play forms. Like he used to feel that suddenly when he was performing, he used to have choking of voice, and he was wondering why he was having it. So what he did was he placed a three-dimensional mirror, and after every act, he used to go and stand in front of the mirror. So what happened? Starting when he stood, he felt there was no change, and slowly when he started repeatedly doing the same activity, that every act used to go and stand, every act used to go and stand. So he realized that no, my posture is not correct. So when he was putting his chin forward, he was having more of his problems. So what he did, he tried to change the positions, when he was feeling comfortable. So in that, he developed sitting, standing, and moving with safety and efficacy, different positions, which work wonders. So this special technique is very effective in low back pain, and it increases when there is an increased muscle tension, for balance, shortness of breath, and digestive problems. Now, ladies can practice this horizontal technique to help release muscle tension, and it helps in breathing. So it increases the breathing capacity too. So it restores the body original poise and posture, and it also helps in calm down. And yes, of course, few things to be considered is here I've shown two figures of a tortoise. The first one you can see a tortoise inside the shell, another one tortoise is out of the shell. That is, like whenever you are doing any activity, it should be done in mixed pattern. So a pattern should be developed, and then we should do any activity. Because, like, if you are instructing someone, now you breathe in, now you bring your arms forward. So this neither looks good, nor it helps understand the person whom you are trying to teach. So whenever you are doing any activity, or whenever you are teaching any activity, it should follow a pattern, and the pattern helps more as compared to single steps. So we should try to do that in pattern. Now, there are different yoga poses too, which can be done to correct posture. And this child pose, especially we call it Balasan. Balasan is being done in two positions. In front also we can take the hand, and the other one we can take the hand back. It's very relaxing, and it helps to bring the alignment. Now you have banana pose, and like that you have variety of yoga poses. There are few more exercises being shown. I'm not emphasizing much into it because we are dealing with some other topic. Now, because of ill-fitting bra, the other problem comes up, that is your fibromyalgia, right? So mainly because of fibromyalgia, you get fatigued, you have brain fogs, depression, then chronic widespread pains you have all around, muscles and joint tissues, then you have digestive problems. So develop here, when you can see in the figure, there are several trigger points being developed due to this fibromyalgia, and that is because of ill-fitting bras. So anteriorly and posteriorly, there are few trigger points which are developed from top to bottom. Here, few yoga poses are being shown in sitting, which can be done when you are at your workplace or you are relaxing. So, now coming down to the second part, before we enter into ill-fitting and right, ask yourself one question. What are you wearing? Whether you are wearing a pain or you are wearing a gain. So in the picture, you can see different types of positions of the bra being handled by the lady, right? So which one is your position? You should check with that, and then only we can move ahead. Now, the very first thing which we forget is about the cups. So in 1935, Warren Brothers incorporated breast volume into bra size, and the alphabet bra cup size system we wear today was launched. So these cup sizes vary from A, B, C, D, and now different companies, they have named it till N numbers. So you have level 1, level 2, level 3, like that. Now, bra size is difficult to measure and we don't have an accurate size, right? So while measuring the bra, few things to be considered is breathing, posture, and how thin you are. So researchers suggest that bra size measurement should take place over a well-fitted, unpadded, and thin bra. But most women are likely to be fitting in a shop because we directly go into the shop and we purchase that. We don't even think that we should take the measurement. Now, coming to this, so some common ways in which bra fails us are chest strap too loose. Now in this figure, you can see the lady, she is wearing a loose strap, and mostly it happens with the woman, whatever kind she is having, she puts on. Now over tight shoulder straps, here in the second figure, you can see over tight shoulder straps, and wrong size cups can lead to compression and pain. Because of that, we are developing your bra strap syndrome. Now, low quality material that loses, and that is because of poor quality of elasticity. So, how do we do? So, follow proper guide for breast fittings. Now, follow these three bra fitting steps. We divide it into three sections, and it's very easy to measure. So, here you have a midline, sternum is here, and umbilicus is here. So we have a central line drawn here. Now you have a nipple line drawn here, right? And inframammary folds are here. A and A dash is being known. Now you can measure in inches, you can measure in centimeters. So what are we supposed to do? So measure your band. So first thing, we have to measure the bands. So wear a light lining. Starting, we have mentioned the dress on which you are measuring should be thin. So measure a light lining bra so your breasts are as close to as natural. Now, how do we do? So we have seen the midline. We start from the center. This is the band, right? So first measurement should be from here. So from the center line, which is being drawn from your sternal end to umbilicus, we are putting to the band, and from there we are starting a circle. So this is the circle which we have measured. So now, other thing which we have to keep in mind, that it should be always straight, it should not fall down, the tape should be on the band. So only thing which we require is a tape, right? So the other thing which we have to consider, that write down the measurement, the number which is coming here, and then follow the next step. Now measure your burst size. So you have to place the tape in the center again to the midline, which we have drawn. Now we put it here, and then again a circle comes up. So here natural breathing should be there. If you have to take the right measurement, you have to be relaxed, and then you have to just stand in front of the mirror and you have to just measure, right? So now what you're supposed to do is you have to write this number 2, and now subtract the band size from your burst size to find the right cup. So how do we do that? It's too easy. So to find the correct cup size, you need to wear a bra measuring around the fullest part of your burst across the nipple using a measuring tape. Now again, the measuring tape should not dip down around the back. Now subtract your band size from the number you get. The result is your cup size. So already we have seen that there are different sizes, A, B, C, D, it goes on. Now, I'll give you one example. For example, measurement around the fullest of my burst size is 14 inch, right? So if I take a burst size Then subtract 36, the band size which is coming for me. So the result is 4. So 40 minus 36. So 4 comes. Now here again we have to consider one thing, that if the number is coming in even, then you write that number. But if the number is coming in odd, you add 1. Right? So if it is 5, you have to measurement. For me, it will be wearing the DD cup size. Now, coming now, what is the sister size? That's what we were talking about, that if it is 1 plus, what do we do? So even few months ago, like, I did not know what was the sister size. So see, what is exactly the sister size? We do that. To find a sister side, you have to go down to the band size. We have already seen the band size here, right? And then you have the cup size. So band size also, you have a strap here, and in the cup size you have to measure the full cup. So what you're supposed to do is, either you, when the band size is increasing, your cup size should decrease, and when the cup size is increasing, your band size should decrease, right? So here in the next figure, for example, if you have original size which is 34C, so if you are going for sister size down, what you're supposed to do is, your band size should go down and your cup size should increase. And the other way around, if you're going for sister size up, your band size should go up and your cup size should go down. So now, what are the signs of wearing an ill-fitting bras? So now, you are wearing the wrong size bra and your bra straps are slipping off your shoulders or are too down, digging the skin. That is too tight, it's pressing on it. So how do we check that? So if the strap starts to slip off, then try a sister size with a smaller band or fasten the straps tight. And if the straps are too tight and straight to dig into your skin, then you may need to try a bigger band size or loosen the straps. So if you are able to slide 2 fingers easily as shown in the figure, then your size is correct. Now, how to wear an underwire bra? Already in the previous slide, we showed one underwire cover. So underwire bras give extra support to the kneading area. It's not necessary that every female should have the undergarment with the underwire. So the thin piece of metal is being run around the sides and around the downward angle. And here, in addition to give better support, an underwire gives you bosom a more natural round shape. Basically, it is worn for that. When fitting for an underwire bra, you should be sure it lays flat against the breastbone and it should neither press against your chest, forcing your breast down, nor rub against your breast. Now, uncomfortable underwires. What are uncomfortable? Here in the picture, again, easy in both the pictures you can see it's being marked. So the underwire is thrown into the cups of a bra and is designed to provide support to your bust. So it should sit comfortably under and to the sides of your bust. Now, if the underwire feels too tight to digging into your skin or stretching your movement, then you should go up a band size. And if you feel that underwire is too loose or floating, then you should go for a smaller band size. So if the underwire is sitting comfortably under your bust, then you're wearing the right size. Now, what are the cup contacts? So the cups of the bra hold and support your bust. So they may or may not have an underwire sewn into them always. So you can keep them basis of your requirements. So cups as well fitted bras will cover and contain all your bust. sorry, tissues without feeling cramped. Now, again, here we have to see if there is a space between the burst tissues and the cups, it's big for you, and you should go down a cup size. And if you find that your burst is slipping over the top or sides of the cup, then you should go for a up size. So if the cups and underwire sits well on your body, then only the size is right. Sorry. Now, what is band size? Now, the band helps to keep the bra in place and supports your burst cups. So a well-fitting band will sit straight along your back parallel to the ground. So you have to see that. So in the picture, it's being seen that it's parallel. The third figure is showing it's parallel to the ground. And this is the right way to put on. So if the band rides up, it is wrong. Again, when it is going down, it is wrong. Okay. So you have to find out where exactly it is coming parallel to the ground, and it should be placed that way. So sports bra, it's coming into play and almost it's no everywhere, because we are much into sports, and it's most important while we are selecting which kind of sports bra should be worn for a female, because while you are performing any action or any activity, it plays supportive role for it. So while selecting and underfitting, you have to consider few points. So here we have just shown you that a sports bra can give adequate support and correctly minimize movement of your breast, causing less harm to your chest and resulting in less pain in that area. So a sports bra is necessity when doing exercises such as running, yoga, or lifting weights. And regular exercises can help people maintain a moderate weight, thereby reducing their risk of developing breast cancer. So, which exercises you are doing determines which type of sports bra to be chosen. Here, for running, especially, you should have a high supporting and high impact sports bra. And while you are walking, low support and low impact bra should be used. So, these are few things to be considered, and most important thing actually. So sports bras can cause breathing issues because if it is tight fitting and the bands are not proper, and when it is not being selected according to the cup and band measurement, it creates problem to the sports person. And they aren't a bad thing actually, but it should be worn correctly. It helps you when the things are selected in a proper way. Now, what are bralettes? Okay to wear or not? So I hadn't heard about it before I started researching about this topic actually. So the bralettes, this term is not new. It came into 1920s and 30s only. And a bralette is a bra, and it is in its basic form. So they have an underwear or padding, making them comfortable and casual for most wearers. Now, they are available in different sizes, and it's there for the females, and it's on to their preference when they want to wear. So for the casual wears, it's too good. There are cup and underwear bands being shown here. So try it before you buy it. Most important thing to be considered here. So here are few guidelines to ensure a proper fit, and it's most important. So when putting on a bra, bend at the waist end and have your breast fall into the cups. Now, the second thing to be considered is the band should be at the same level, that is the back and the front as shown in the previous slide. Now, over time, the elasticity of the band will loosen. So this will require you to use the middle hook. You have 3 hooks, the front, the middle, and the back hook. So as time passes, you have to keep on changing the hook. Then only the fitting will be proper and will be helpful for you. So once the last hook is being used, so now just think that there is a time to change the new bra. That is, usually it should be changed between 6 to 9 months. Now, what type should be worn? Usually, the wider straps are good, and because weight has to be beared on these straps. So this, when the band and the strap is broad, this here, the strap is broad, so it carries up the weight properly. So try to focus on this. Now, having disturbed support on the shoulder is essential in a healthy fit. So look for a wider and soft straps. Adjust your straps periodically. Straps loosen over time and should be adjusted to maintain the proper support. Now, laundry correctly, washing your bra on a delicate cycle and handling to dry should be kept in mind. So, coming to take away home message. Now, mainly, many females experience breast related issues that are considered to negatively impact healthy and well being. So, these includes breast cancer, issues related to incorrect bra fitting, and issues related to breast movement, including an increased incidence of breast pain, breast sag, and embarrassments, which can be a barrier to a physical activity participation. Knowledge and awareness of these breast issues among female is too low. Now, a well fitted bra would help a woman achieve the following: so, great comfort, excellent support, prevent premature sagging of the breast, enhances a woman to look years younger, initially helps a woman look slimmer. It can boost your confidence both physically and mentally, improve posture, elevate all pains, and contribute to good health. Good quality bras will last longer. You will never have to wear another uncomfortable bra ever again, hopefully. So, now what are the dilemmas? So, main dilemma is there is not enough scientific evidence to confirm whether or not wearing a bra or going braless can cause the breast to sag or change the shape. So, the biggest dilemma is this. Now, smart teens guide to mysteries of her body. So, teaching adolescent girls about breasts from a young age can be used to inform effective breast education in schools. And it is recommended that education on multiple breast topics should be introduced in schools, preferably being first education in primary schools with a modular structure and progressive information. So we need to reshape our own perceptions of how we have to step up as women and take the lead. So happy Women's Day. We'll meet again. So over to you, Chandni.
Thank you so much, Dr. Smita ma'am, for such a great and awesome presentation on such topic.
Thank you so much.
So now we are open for all your questions and queries. So you can post your questions in our chat window in Zoom as well. We are live on IAP India YouTube channel. So you can post all your queries over these two channels.
Hello, everyone. Just now, ma'am, we are having 5 minutes with us because at 5:45 we have to start the next webinar because it is the Women's Day. Please wind up within 5 minutes. Okay, ma'am?
Yeah.
Sure, sir. I believe like we had such a great explanatory presentation, leaving no doubts behind. So thank you so much, Dr. Smita ma'am and Dr. Anuja ma'am for such wonderful session. Now I would like to invite Dr. Joshni ma'am for vote of thanks. Over to you, ma'am.
Hello.
Yeah, ma'am, we can hear you.
Thank you, Chandni. Good evening and a happy Women's Day to all of you. On behalf of IAP Women's Cell Bihar branch, I would like to thank all the participants and panelists who are present here in this webinar. First of all, many thanks to our resource persons, Dr. Anuja Bharti and Dr. Smita Singh, for such a wonderful presentations. Many thanks to IAP Central team headed by Professor Sanjeev Jha sir, and National Head Women's Cell, Dr. Ruchi Varchane. I would like to extend my hearty thanks to IAP Bihar branch under the leadership of Dr. Narendra Sinha sir. Many thanks to our team of IAP Women's Cell who have supported all of us. I'm very thankful to our moderator, Mrs. Chandani, and the technical team of IAP team. Thanks to one and all, and a very happy Women's Day to all of you. Thank you.
On this note, we'll end our session here and hopefully we'll meet sometime in future.
Yeah, sure.
Thanks a lot. Thank you. And don't forget to subscribe IIP India YouTube channel. All the delegates and thanks to the Bihar branch for conducting such a wonderful webinar and celebrating the Women's Day in such a nice way. Thanks a lot. I just showed my gratitude to our Dr. Sanjeev Jha, IIP President, and Dr. Ruchi Varchane, IIP Women's National Head, for providing us this wonderful platform. Thanks, everyone.
Thank you so much,